Welcome back. We are talking about how to prevent and treat infectious diseases naturally. And in the previous video, I have explained to you what infectious diseases are and the major causes of infectious diseases. We also talk about the symptoms that those who have infectious diseases do exhibit or do feel in their body. We also talk about those who are at risk of having infectious diseases. Now we are going to look at how infectious diseases spread. So how do infectious diseases spread? Depending on the type of infection, there are many ways that infectious diseases can spread. Fortunately, in most cases, there are simple ways to prevent infections, as in they are avoidable. Now, your mouth, your nose, and cuts in your skin are common places for pathogens to enter your body. Diseases can spread, number one, from person to person. When you cough or sneeze, in some cases, droplets from cough and sneezing can linger in the air. So if someone around you just sneezes or cough, you think it has ended like that. No, at times it will still be lingering in the air. Okay, so we really have to be careful when we are in such environments. How do infectious diseases spread? Continue. From close contact with another person, like kissing or oral, anal or vaginal sex. By sharing utensils or cups with other people, or even cutleries like spoons and fork with other people. On surfaces like doorknobs, phones, and countertops, like your table, your desk, probably in the office, your dining table, your phones, your doorknobs. That's why you should always attempt to sanitize your doorknobs. You can also sanitize your phone. Just use a dampened cloth. Maybe you add little spirits, not wet like that. Use it to clean your phone regularly to prevent infection. There was a write-up I came about some times ago that says that our phone, most of our phones, they are dirtier than our toilets. Some of us don't even care to wash our phones at all. As in, I'm not saying wash. Don't go and soak your phone in water, please. As in, clean it, sanitize it. Just get a dampened material, a clean material. Put a little spirit and use it to clean the surface and other parts of your phone. At least do that once in a week. It will also help you prevent infection. Okay, so by our countertops too, your desks and all that. Through contact with poop from a person or animal with an infectious disease. Through contact with poop, that's the excreta from an infected person, probably the toilet you use. This is the cause of most toilet diseases. What people say toilet disease. There's actually nothing like toilet disease. They are all infections, but because you got them, you get it through the toilet. That's why people say, oh, they are toilet diseases. Okay, you can also get infectious diseases through bug, like mosquito or tick, or through animal bites. Infectious diseases can be gotten from contaminated or improperly prepared food or water, like seafood, for example. Seafood, or like your meat and all that. When you want to prepare them, after washing your fish, of course, if you go into your pot and you are going to expose it to eat, so whatever infection that is left there is going to be killed. But how about the zinc where you wash the fish? How about the zinc where you wash, or the table where you placed it on to cut it, or your meat? You need to wash them with soap and clean. Don't say it's meat. Is it not fish? The fish I'm going to eat, of course, is food, but they could be contaminated. when you cook it, it's going to, as in heat, will help you kill the ones that are still on the fish, but the one in the zinc, the particles or whatever, the bacteria or whatever that has been left, the microorganisms left in your zinc, should be washed. Wash your hand also. After removing the dirt in your fish, wash your hand with soap and water. If possible, sanitize your hand. After washing your meat, sanitize your hand. You know, all those animal food do carry infection. As in, it might not be that the animal is infectious in itself, but it could be in the process of transportation, moving it, you know, from one place to the other, is being infected. And that is why you need to clean everything that comes in contact with that food. Now, another way is from working with contaminated soil or sand, like gardening. You can also get infections from a pregnant person. Okay, sorry, this from the baby to the mother, from the mother to the baby. So a fetus or an unborn baby can get infection from the mother. Like a mother who has HIV, the baby is likely to also be born with HIV. From blood transfusions, organ tissue transplants, or other medical procedures. Now, how are infections diagnosed? How do you know if you have infection? Because some of them are asymptomatic. They are asymptomatic. That is, they don't show, the symptoms don't show, they don't give you any sign that something is wrong. So to diagnose infectious diseases, your healthcare provider may order that you do one or more lab tests or imaging scan to help determine what's causing your symptoms. Number one is a laboratory test. You may be required to go for laboratory tests. Okay? Many infectious diseases have similar signs and symptoms. Samples of blood fluids can sometimes reveal evidence of the particular microorganism that is causing the illness. This helps the doctor to tailor the treatment, as in by going for lab tests. After you might have give your complaints, lodge your complaints with your physician. Okay, the physician will now tell you, go and run a lab test, because these symptoms you are feeling, you are having, it could cause so many things. So by the time you run the lab test, the particular problem will be detected, and then treatment can be tailored towards that particular treatment. To diagnose infectious diseases, you may have to go for lab tests. And what are the things that you do when you go for lab tests? When you get to, you can do blood tests. You can get to detect infection by doing blood tests. A lab technician will get a sample of your blood by inserting a needle into a vein in your body, usually in the arm. And then the blood sample that has been taken will be taken to the lab, will be worked on by the technician, and then they will be able to discover the infection that you have, that you may have. Another test is urine test. This painless test requires you to urinate in a container. To avoid potential contamination of the sample, you may be instructed to clean your genital area with an antiseptic pad and to collect the urine midstream. Another thing that can be done is throat or nose swab. Samples from the throat or nose or other moist area of the body may be obtained with a sterile swab. That is, the technician will try to get maybe some things in your nose, like mucus or something in your nose, and then they will examine it in order to, you know, discover what could be the likely problem. And it could be your throat. You can take samples from your throat and take it to the lab for examination. Stool samples too can be taken. You may be instructed to collect a stool sample. So a lab can check the sample for parasites and other organisms. Spinal tap, that's lumbar puncture. This procedure obtains a sample of the cerebrospinal fluid through a needle carefully inserted between the bones of the lower spine. You will usually be asked to lie on your side with your knees pulled up towards your chest. Then you'll be able to get that sample. Okay. Another thing aside lab tests that you can be instructed to do is image scans. Image procedures such as x-rays may be needed to be carried out. Computerized tomography and magnetic resonance imaging (MRI) can help pinpoint diagnosis and rule out other conditions that may be causing the symptoms. Okay, so those are the tests you'll be required to do. So if you are having any of the symptoms that I've mentioned earlier, please go and check yourself. Health issue or a disease that is discovered early will be easily treated. It will not take you a long time, and it may not cost you much money to treat it if it's just at the early stage. But if you prolong, if you delay and procrastinate, and you didn't get to dictate all this issue until you are seriously sick, by that time it might be chronic and might take a longer time to now get treated. And of course there are some infections that medically are not curable medically. Okay, but naturally all infections can be taken care of. Okay, so if you are having any of the symptoms that I have mentioned earlier, please go for checkup. Go and check your body. I repeat, if you are having any of the symptoms that I mentioned earlier, please go and check your body. If you're always having fever, chills, congestion in your chest, you're having congestion in your chest, that could be short breath. You're having short breath, like you're not breathing well. Something could be wrong. Go and check before it gets bad, before it gets chronic. And then you are always coughing. There's this type of cough. If it's just normal cough, that in no time, probably within a short period, you treat it and you are well, no problem. But if the cough, after treating cough for a long period of time and it's still not gone, then there's likely to be a serious infection. Even if you have the regular cough, there's an infection, but it might just be a minimal one, might just be an acute one. It's not serious, it's just minor. And once you take probably some medications, some natural medications especially, okay, there's this medication I usually give for cough. If you try to take that medication, as in this fruit combination, that's natural cough remedy. For those who have been following us, you should be familiar with this natural cough remedy. If you took that remedy, cough will disappear maximum within 2 days, maximum. Some within under 24 hours, the cough will disappear. But if you took it and there are no changes, then you have a serious infection. You need to go for tests so that it will be discovered. Now, let me quickly give out this natural cough syrup for the sake of those who are listening to us for the first time, or those who are not aware of the natural cough syrup. Now, what do you use? Very simple. They are the things you get around you. They are in your market. they are on your street. In fact, some of these things may even be in your kitchen. So what you need are pineapple. You need pineapple. You need ginger, a clove of garlic, lime or lemon, the juice, lime or lemon juice, and honey. If you are diabetic, you can remove the honey and use the remaining, because those who are diabetic should not take honey to increase your sugar level. So if you are diabetic, use the same thing I've mentioned, just omit honey. That's all. If you are not diabetic, you can add the honey. It's part of the remedy. It's very good. Children can take it, adults can take it. So how do you prepare it? Just get a medium-sized pineapple. Add like a finger of ginger. A finger of ginger. You know when ginger is together like this, not too much, especially if it's for children. Don't add much. Let the ginger be obvious, let them feel that, but don't add it too much if it's children, so that they will take it. Okay, but for adults, put enough ginger. So if you have a medium size pineapple, you can add a finger. You know how ginger looks like, a finger of ginger. You don't need to peel, because the skin is also medicinal. Just wash the ginger very well. As for the pineapple, peel the pineapple and cut into pieces. Pour into your blender. Okay, then the ginger, wash very well, sanitize with salt, sea salt preferably, and then dice into pieces. Add it to the blender. Then get a clove of garlic, just one clove, one small clove, so that your mouth won't be smelling. If you just add a clove, it will not smell at all. So just a clove of garlic, and then you add that. You just wash it. You don't have to peel the garlic too, because the garlic skin, that back of garlic, is very medicinal too. So you don't need to peel. Just rinse it well, and then sanitize with sea salt or white vinegar. Rinse very well. Add to what you have inside your blender. Then get lemon or lime, like 4 lemon or lime if they are small. If they are big rather, but if they are small, maybe like 5. Cut them and bring out the juice. Squeeze out the juice into a cup. Then remove the seed and then pour the lime juice into your blender, as in add it to the other things inside the blender. Then you can also add like a tablespoon or 2 tablespoons of honey, depending on how sweet you want it. You can even add 4 tablespoons of honey, especially if it's for children. Add enough honey so that it will be sweet and they will like to take it. Honey is also good. It's part of the remedy. But remember, if you are diabetic, remove it. The others will still work for you. So you can add some quantity of water and blend everything till very smooth. Pour into a container and take it on an empty stomach. Preferably on an empty stomach, and preferably take it immediately after blending. If you want a fast action, you want to see the effect fast, drink immediately after blending. However, you can also make and keep in your freezer or your fridge and be drinking. Okay, if it's much, you can keep in your fridge and be drinking. But if it's not fresh, but you should finish it under 24 hours. Finish it. You can make the one for a day and then take it 3 times daily, morning, afternoon and evening. Take 3 times daily. Even children, it's food, so there's no dosage. Pineapple is food. You can eat pineapple as fruit. Ginger is food too. The garlic there is just 1 clove. Lime juice is not many there. Okay, but you can see that this is a big preparation. You can half what I've given you. You can divide it into 2, like half of a medium pineapple, half of a finger of ginger, you see, use 1 clove of garlic, and then other things. Oh, sorry, my light is off, so I'll quickly try to round off so that you can see me. Sorry, NEPA just took lights as usual. We are in Nigeria. So you can do half of that recipe that I gave you. If you want to make it and finish it at once, you can do half of what I've given you. Okay, so that is how to prepare. Take it on an empty tummy. Don't take it on food. If you take it on food, it will not work. You take it when your tummy is empty. In the morning before you eat, and in the afternoon, at least 2 hours after. Must be 2 hours ago that you ate, or in the afternoon before taking your lunch, and then in the evening before taking your supper. You will see that the cough will disappear. However, if you take it after if you took it after 3 days, it's not gone, still continue till 5 days till it's gone. But even if after a week it's not gone, then you have a more serious infection. You need to go and run the test so that we know the cause of the problem and then treat it. So that is all about our health talk today. Next week we are going to start how to treat infectious diseases. The treatment will be dealt with next week. So same time, same day next week. Every Thursday is our weekly health talk or health webinar. Try to make it a date to be with us next week Thursday by 8 p.m. as we continue with this wonderful topic. In fact, we are still going a long way. You are going to learn a whole lot of things. So don't miss this health talk for any reason. Invite your loved ones, invite your friends, family members. Everyone needs this. If you don't have the issue, you would like to learn how to prevent it. So make yourself available even if you don't have the health issue. And if you have it, you know how to go about getting treated for it. So see you next week. Thank you and God bless you.